السلام عليكم ورحمة الله، ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Questions. This is lecture number 7 in Maternity and Child Health Nursing and number 46 in Ghaith Review. Today we're going to discuss 5 questions from question number 247 up to question number 251. معاكم محمد الثمانية هي نبدأ مباشرة. Question number 247. Which of the following is independent function of primary health care nurse? The options are number A, complete history and nursing assessment. Number B, referral for diagnostic evaluation. Number C, medical examination. Number D, psychotherapy referral. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number A, complete history and nursing assessment. اللي اخترنا الخيار رقم A نشوف rational. A primary care nurse is a nursing professional that works in a primary health care center or primary health care setting, the first level of medical care. Primary care nurses are responsible for performing the initial patient assessment and physical consultation before physician examine the patient. So the correct option is option number A, complete history and nursing assessment. Regarding to the option number B and D, referral is an independent nursing function for the community health nurse, not the primary health care nurse. Question number 248. Which of the following statement by the nurse describes the effect of clomiphene or clomide as an ovulation-inducing drug? The options are number A, given for the first 15 days in each cycle. Number B, maximum dose is 50 mg daily for a month. Number C, increase the risk of birth defects. Number D, it increases the risk of multiple pregnancy. وقبل بدي هنا اختار الخيار بشوف صحيح. The correct option is option number D. It increases the risk of multiple pregnancy. اللي اخترنا الخيار رقم دي نشوف rational. Clomiphene acts as an anti-estrogen and stimulates the release of luteinizing hormone, which results in the maturation of more ovarian follicles than normal, which in turn may increase the chance of multiple pregnancy. So the correct option is option number D. It increases the risk of multiple pregnancy. Regarding to the option number A, given for the first 15 days in each cycle, clomid is taken on day 3 to 5 of the cycle and continues at the same time every day for 5 days. And regarding to the option number B, maximum dose is 50 mg daily for months. The starting dose is 50 mg, but if the dose not induce ovulation, the dose may be increased up to 100 mg. And regarding to the option number C, no evidence of birth defect with using clomiphene. Question number 249. A 50-year-old woman is attending the outpatient clinic for annual checkup. Which of the following should be reported if inspected during breast examination? The options are number A, everted nipples. Number B, symmetrical visible. Number C, dimple in the left breast. Number D. Right breast is slightly larger than left breast. وقف الفيديو هنا واختار الخيار وشوف صحيح. The correct option is option number C. Dimple in the left breast. اللي اخترنا الخيار رقم C نشوف rational. Dimpling of the breast tissue can be a sign of serious form of cancer known as inflammatory breast cancer. It causes the skin to look like the bitten and uneven skin of an orange. Sometimes the skin can also be red and inflamed. So the correct option is option number C, dimple in the left breast. The remaining options are normal finding. Question number 250. A pregnant woman is 36 weeks pregnant, was admitted to antenatal ward for observation after being involved in a car accident. She refuses when the nurse tried to touch her abdomen to perform an examination, saying that it is painful. She also presents mild vaginal bleeding. Which of the following is the most appropriate diagnosis? The options are number A, placenta previa, number B, tubal pregnancy, number C, abruptio placenta, number D, inevitable abortion. وقف الفيديو هنا واختار الخيار بتشوف صحيح. The correct option is option number C, abruptio placenta. ليه اخترنا الخيار رقم C نشوف rational. Abruptio placenta is a separation of a normally implanted placenta before the fetus is born, characterized by acute abdominal pain or uterine tenderness and vaginal bleeding. In the revealed type, trauma considered a risk factor for placenta abruption, in addition to chronic hypertension, cocaine use, preeclampsia. So the correct option is option number C, abruptio placenta. Placenta previa and inevitable abortion are characterized by painless bleeding. An ectopic pregnancy refers to the implantation of the products of conception in a site other than the endometrium. So the correct option is option number C, abruptio placenta. Question number 251. Mother of 9 children, 3 of them with congenital anomalies and 1 with Down syndrome. She is a primary school graduate with low financial status. She is not using any method of family planning. Accordingly, the primary healthcare nurse has referred her for counseling. Which of the following is a model concerned with a disability as form of social injustice due to stigma or discrimination? The options are number A, health belief model, number B, biomedical model, number C, socio-political model, and number D, economic. وقف الفيديو هنا واختار الخيار بشيء صحيح. The correct option is option number C, socio-political. اللي اخترنا الخيار رقم C نشوف rational. The socio-political model implies that disability stems from the failure of the social environment to adjust to the needs and aspirations of people with disabilities, rather than from the inability of disabled people to adapt to social demands. So the correct option is option number C, socio-political. شكرا جزيلا. نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.